I'm very happy for the opportunity to be here and to tell you a little bit about what we do at the center. First, I'm going to give a culturally appropriate greeting and see if any of my people out there. Awagwan Idren. Anyone? Yes. All right. Good, good, good. So it's an amazing week in Las Vegas. We have a lot of unprecedented events going on here. A lot of you have been in cities where this has happened all the time, and you're used to it. But for us, this is really, really unusual to have this big event here this week, to have this going on. It's kind of inconvenient for the locals, but we need it, and we're glad to have it. And of course, I'm talking about the rain. I work at Cleveland Clinic Ruvo Center for Brain Health. We are a subspecialty center that takes care of people who started for folks with Alzheimer's disease and other cognitive disorders. We added on movement disorders, Parkinson's disease, Huntington disease, progressive supranuclear palsy, et cetera. And then central nervous system neuroimmunological disorders like multiple sclerosis. And we have found out in doing our work here that the work that we do is desperately needed in this community. Not just because it's desperately needed in every community, but because Nevada and Las Vegas are what's called neurology deserts, meaning that there's nowhere near enough neurologists to take care of the individuals who have neurologic conditions. And furthermore, we're a geriatrics desert. We don't have enough geriatricians to take care of the elderly people. We are the second fastest growing state in the United States, and we're also either second or third fastest growing in the expected number of Alzheimer's disease cases. And as we know, Alzheimer's disease disproportionately affects African Americans, people of Latinx backgrounds, and probably other communities that we aren't as aware of. Women are also disproportionately affected by Alzheimer's disease. So at our center, we try and provide 360-degree care for these people. We have the advanced diagnostic techniques, of course, the medical evaluations, the rehabilitation facilities. So we have speech, physical, occupational, music therapy, caregiver support and education. And we do a lot of education also for the community, for professionals. So we've had about 72, I think it is, CE conferences in our 15 years. But we're really underperforming when it comes to the brain health of communities that are disproportionately affected and yet underrepresented in research, as well as in the folks who take care of individuals with brain disorders. I was asked to talk a little bit about the brain health of Black men in Clark County. I don't have a lot of direct information, but I can give you some statistics that give you an idea of what we're facing in terms of the risks to the brains of Black men in Clark County. So the Black population in Clark County is about 11%, 11.5%. So a little bit smaller than the national average, but obviously a substantial number. But there are huge disparities in terms of the risk factors that lead to the development of cognitive dysfunction, including dementia, not just dementias that result from neurodegenerative diseases, but dementias that result from general medical conditions. So sort of starting off with, I think, what is maybe the earliest risk factor for developing dementia, education. About 18% of African-American men, or African-Americans in Clark County, are college graduates. That compares to 27% of the white population. About 74% are high school graduates. So we're starting off with education, particularly college graduation, being a risk reduction factor, starting off behind. Fewer than 1/3 of the household incomes of African Americans in Clark County is above $50,000. That compares to 61% of the white population. And now looking at a direct sort of brain health measure, the rate of death from strokes in Clark County for African Americans, about 74 per 100,000. The rate in the white population is 37%. The rate in the Hispanic population is 28%. About 67% of African Americans in Clark County are obese. 25% say that they engage in no physical activity at all. About 26% have been told that they have elevated blood pressure. Now, being told that you have elevated blood pressure is not the same as having elevated blood pressure. And I would guess, although I don't have this number directly, that the number that actually have high blood pressure is considerably higher than the number that have been told. And I suspect that because when you look at the white population, 35% of those folks have been told that they have high blood pressure. 29% of our Latinx population has been told that they have high blood pressure. Yet, with African Americans, the rate of high blood pressure is considerably higher than those other populations. So I suspect we're underreporting, obviously, therefore, undertreating, obviously, therefore, undereducated and underaware about this huge risk factor, not just for brain health, of course, but kidney health, heart health, lung health, etc. Head injuries increase the risk for developing dementia. The rate of head injuries in African Americans has increased from 50 per 100,000 in 2017 to 96 per 100,000 in 2021. And that's the latest date for which we have statistics. Diabetes deaths, 69 per 100,000 in 2017. Now we're up to 109 per 100,000 in 2021. So not only are we behind, we're falling farther and farther behind. Yet, only about 14% of people in the African American community have been told that they have diabetes. Now, a more direct measure is what people report themselves. So about 19% of African Americans report that they are having some kind of cognitive problem. Memory dysfunction, not being able to keep things straight in their head, not being able to keep things organized, or decreased performance at work. And this is higher than any other ethnic group in the community, the next highest being white Americans at white Clark Countians at 14.7%. Opioid poisoning and drug poisoning cases are also much higher in African Americans in Clark County than in other populations. And so the state of the union, so to speak, is not good. Hopefully, as we discuss in this panel, we will be talking about ways that we want to address this. At the Ruvo Center, we recognized a couple of years ago that the population in our clinic, the population in our research studies, like many other academic health centers, does not look like the population that's at greatest risk. We have far fewer African American, Latinx, Asian people than we would expect given the base rates of disease in the population. And so we've been working to try and engage these populations because it's important for understanding how cognitive disorders begin, more importantly, for understanding how to prevent these disorders. If you can understand and prevent a disorder in the people who are at highest risk, I think you give yourself a much better chance of understanding and preventing it in those who may be at lower risk but are still at risk nonetheless. So I look forward to being on the panel. I certainly don't have solutions for this problem, but I'm glad to hear what the ideas might be from the other folks who are going to be on the panel. And I think I will end, just with one thing. Is there a Joy here from San Diego? Joy. Oh, Dr. Banks says hi. All right, thank you very much.